All right, everybody. So this is part 2. So we were talking about how these vertebrae have these intervertebral discs between them. And so now we can come down here, and this is that intervertebral disc. And you can see how it's kind of just sits there. It's a nice little cushion there. Now the reason why this could be a problem is this nerve comes out the end here. And if you end up having like a blowout on one side, what ends up happening is, see, that's a jelly donut I was talking about earlier. That's the outside of it, nice little hard fibrous collagen basically. The inside like a glycoprotein goo. What could happen is if it gets pinched, normally that's okay. If it gets where it herniates, where it pushes out on one side, then what you get is you get a permanent pinching of the nerve right there. And that's gonna create pain. That's not gonna feel very good. And that's what we talked about earlier with fusions and stuff like that. So if you get an x-ray of your back, the x-ray is not gonna pick up the disc, but the x-ray tech's gonna be able to pick up, the radiologist is gonna be able to pick up what's going on here with that disc, on whether or not it's gonna be herniated or where it's gonna be blown out on one side, etc. Now, we're gonna move off of that, and now we're gonna talk about those thoracic vertebrae. Remember, we have 12 thoracic vertebrae. And so we're gonna talk about those vertebrae really quickly. If you look at my skeleton here, you can see that these 12 thoracic vertebrae are all attached to ribs all the way down. And this is how you know you're on a vertebrae here. And so I'm gonna bring my little skeleton over. And what we can see is, I'm gonna turn this guy around. We are at cervical vertebrae number 7, doesn't have a rib attached. And then we're at thoracic vertebrae number 1, T1. And so it's gonna have a rib attached right here. And so you can see that rib right here attached to thoracic vertebrae number 1. Now, you're probably not gonna be able to feel that on yourself. You're not gonna feel a lot of these ribs until you get a little bit lower. And so then we go T1, of course, T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, T12. So we got 12 thoracic vertebrae all the way down, each one holding onto a rib. Now these ribs, their main job is to protect. This main job is to protect all the organs up here. So your heart is up here, your lungs are over here, your liver and your stomach are peeking out right underneath this. So we're protecting all that. And on your back, we've got our kidneys being protected underneath these guys back here. So all the really important kind of structures of your body that keep you alive are all being protected by this cage here. Now, if you notice, there's something kind of funky going on here. If you look, what you're gonna see is there's an opening here. So there's a big opening right here. Now, the reason why is because if this cage was all the way down, we would not be flexible at all. We fell on our back, we wouldn't be able to sit up. So this allows for flexibility. Plus, if you're a female and you end up getting pregnant one day, it might be a nice thing to be able to have that baby be able to grow outwards and not get stuck, or else all that baby be over here. So it pushes upwards and outwards, etc. So this is nice and open like that. Now, that means that our ribs are gonna be a little bit different. We're gonna have ourselves 1, 2, 3, 4 of these ribs up here at the top, really 5. These ribs up here, these are true ribs. And basically what we have is we go rib to cartilage to the sternum. Now this is what's called the sternum. This is your breastbone, your chest bone right here. It runs right down the center. Now, why do we have cartilage here in the center? You can see that that's cartilage. One of the things we want is, if this was all solid bone and you get hit, there's a good chance this thing is gonna break. There's a good chance this thing's gonna snap. So that cartilage there allows for flexibility. All right, so number 1 is if you get hit, it's able to squish. Number 2 is, this is gonna allow for some flexibility when you breathe in, when you inhale, inspire, expire, inspire, inhale, exhale. This is going to be able to squish and kind of go a little bit as well. All right, so this flexibility here, it is not going to make this guy solid because we don't want breakage. We want kind of like a shock absorber. Imagine jumping and landing straight with your feet just straight, it would hurt really bad. But if you fall and you hit the ground and you kind of bend your knees, you're not going to break. You fail like this and hit, and it's going to snappy snap. So we have our cartilage right here. So the first few ribs we have here, these are true ribs. And then if you look, we have ourselves ribs that go rib to cartilage to more cartilage to the sternum. We call these false ribs. All right, they kind of go via extra cartilage here, getting up to the sternum. And so the true ribs, really nothing really special about these. They're rib to cartilage to sternum, rib to cartilage to sternum, false ribs. And then finally at the very end, over here, we've got two extra ribs that are going to be protecting your kidneys. These are called floating ribs. And so these guys don't go all the way up to your sternum. These are just floaters down here. And so they're protecting the kidneys right there. Now, all of these are attached to the sternum, except for the floaters, to the sternum. And we also have right up here, if you look, it looks like a necktie. This is called the manubrium. The manubrium. It's the manubrium. I think comes from like a word meaning like a hilt of a sword. You think of like the base of a sword, like right where you have your handle, and then the manubrium's right here. But anyway, it doesn't really matter. We have ourselves the knot of the bow tie. So if you take your hand, find your knobby knob here. So these are your knobby knobs. It's the end of your clavicles. And then you go right below it. You're now at what's called the superior sternal notch. So the suprasternal notch right there. And then down, we're on our manubrium. And then you go down even further, and now you're on your sternum. Now, with that being said, this manubrium and sternum acts like a little bit of a hinge joint. So imagine this manubrium, here's the sternum. It's gonna kind of go like this. And what that's gonna do, it's gonna allow for more flexibility in the chest. And one of the nice things is, if you need to go ahead and give chest compressions to somebody, you push down on that sternum, all right? And when you push down on that sternum, that little bit of a swing helps to push down. You can palpate the heart down here. Plus this cartilage allows for palpating the heart. Now, it's not that flexible, especially the older you get, the more stiff these gets. So you start doing chest compressions on somebody, there's a good chance you're gonna crack and break a rib. But it allows for that flexibility. Now, outside of chest compressions, it once again allows for less breakage, also some movement when we breathe in and breathe out. Now, in between all of these, we're gonna come back to this when we do muscles, there's gonna be intercostal. All right, so this is called costal cartilage here. Intercostal muscles right here. And so these are the muscles between your ribs. The reason I'm telling you that is, if you ever eat ribs, really good, really soft ribs, you're eating the meat, the muscle that's in between each one of these. And that muscle's there to help squeeze. So when you breathe out, you're not only using your diaphragm moving up, but you're also squeezing these muscles between the ribs to help push the air out. Now, outside of that, at the very end of the sternum, there's a little pointy point right here. And this little pointy point is gonna help kind of hold some, basically a nice little piece of connective tissue between here and your pubic bone down here. It helps kind of secure your abs down. This guy is what's called the xiphoid process. Now you hear that word oid again, shaped like, and I'll go over this in class again, shaped like, xiphus, nobody would know this, it means like a little knife, like a dagger. And so it's a Greek little dagger. So somebody looked at that and went, hey, it looks like a little knife right there. That's a xiphoid process. Now, with that being said, you can go down, you can feel it. All right, so you can feel the xiphoid down here. So that's the xiphoid process. And if you want to do chest compressions, you find your xiphoid process and you go 3 fingers above it and you push down. You don't want to push down the xiphoid process because what lies right underneath here is your liver, and you don't want that xiphoid process digging into your liver. So this guy right here, the xiphoid process, connective tissue all the way down. We have ourselves our sternum. We have ourselves our manubrium. We have ourselves our ribs. We have our true ribs, our false ribs, and our floating ribs. And they're attached to the thoracic vertebrae, which have that cute little heart-shaped centrum we talked about, so that when these guys come in and they bend in, they can make a nice little landing here. In class, we'll go about, this is one of those areas we'll talk about in class, between men and women that is different. There is gonna be some differences in the ribs right here, and this shape right here. Men's are gonna be a little bit more out, women's are gonna be more like a curtain. And we're gonna talk about that in class. Now, last little bit, you can see my guy here, as we go down, here's our thoracic vertebrae, here's our lumbar vertebrae down here at the bottom. And then we finally are gonna have ourselves some fused vertebrae at the very end. These are gonna be called the sacrum, the sacrum. We're gonna come back and talk about that later, but for right now, what we've done so far was with me being gone, and we're gonna come back, and when I come back on Wednesday or Thursday, we're going to go back into all of this again, but we have ourselves the atlas at the top. We have ourselves the axis next. We have the atlas with the occipital fossa, fitting those occipital condyles in. We have ourselves the axis with that dens popping up, and the atlas goes behind it and spins on it so your head can say no. We have our cervical vertebrae, the 7 cervical vertebrae, which are the neck vertebrae, the 12 thoracic vertebrae, which is going to be the ones connected to the ribs, that has your body on it, and the 5 lumbar vertebrae. With the vertebrae itself, we've got a center called the centrum. We've got the vertebral foramen, or the neural foramen, where the spinal cord is going to run through. And then we've got the spinal process here that runs along the back, which is why it's called the spine. These pointy points all the way down. When we come down to the thoracic vertebrae, we've got ourselves the manubrium, the sternum, and the xiphoid. We've got ourselves our true ribs, our false ribs, and our floating ribs, and we have our costal cartilage here. All right, that's about it. And I'll see y'all next class.